are the parts for the people that always comment. Could you do a little less talking? This is for you. You know, it'd be a better video if you just didn't talk so much.
I think those people just enjoy the people's elbow.
People's elbow, that's right.
How it would anywhere else. Yeah, barely can feel that.
Barely feel L4. This is kind of L4 is the inside of the foot. L5 is the top of the foot. How about the side here, the pinky?
Not too much.
Not too much. So S1. And then as I go up higher,
Yeah, you can feel it once it goes up higher.
we call them dermatomes. So one nerve controls one section of your foot. So this is the lumbar 4, lumbar 5, and then S1, sacral 1. And so to have that level of, you know, it'd be unlikely.
Right.
This is where you know it's diabetes.
I definitely could feel it.
Yeah. Your neck doesn't want to come on over here. It's like a car. I'm letting go on the steering wheel and the car just pulls to the right. I had to work on my dad's feet just like this, just helping him with his, you know, feet also. Just it's tough.
Well, probably, let's say it was Christmas time, and I was headed home. I'm originally from South Carolina, and I usually take good care of my feet and stuff like that, being a diabetic. And I was, you know, doing the normal care, you know, scraping all the dead skin and stuff like that. And there was a blister that was under my toe that I didn't really know about.
Yeah.
So, you know, put some lotion and everything on my feet, drove 7 hours to South Carolina. Got to South Carolina, noticed that the blister was there, and
Yes.
you know, diabetics, that happens. So
Yeah.
I know how to take care of that. You know, you just make sure your foot's clean, make sure it's dry, all of that jazz. I went to a birthday party, and when I was leaving, there was, you know, it's real dark. There was like a pothole that was near my car,
Yeah.
and my foot slipped into the pothole, twisted my ankle real bad. So I was home for like, you know, Christmas and all that stuff like that, and I came back home to Tampa. So it was a span of like 4 days after that happened. And I found myself like shivering real bad, you know, trying to figure out what was going on. You know, I can't be that cold. So
Infection,
exactly. So
Yeah.
I decided I was going to go to the hospital. Told my, you know, job. I said, hey, I'm going to the hospital. Went to the hospital trying to figure out, you know, why am I shivering? They're like, hey, you know, your foot's kind of swole. I was like, well, don't worry about that. I twisted my ankle. That's bad. We need to figure out why I'm shaking. And you know, we did MRIs and CAT scan and found out that I had gas gangrene in my foot. So they told it was like the 4th toe that I had to have amputated. So I got that toe amputated. I healed up pretty fast, but as you can see, there's a
Yes, sir.
nice little scar coming up. They amputated the toe, and they had to chase the infection.
Yes.
So that's a real grisly, nice little picture that I got that I show people.
Wow.
But that happened, recovered from that. What was supposed to happen after that is because of that surgery, they were supposed to kind of give me like a insert that kind of like had a little bump on it that compensated for, you know, when I put my foot down, that 4th toe missing.
Yes.
But didn't do that. So I ended up getting a blood ulcer on the end of my foot there, like
Yes.
under the pinky toe.
I understand.
Because I walk on the
Pressure
edges of my
having to
so
change.
exactly. So had to have surgery there. They removed the knuckle from my pinky toe, and they had to chase the infection there. So under my foot, I have a nice one that goes across.
Yes.
So after that, had another blood ulcer that was coming under my middle toe this time, and they tried to, because it's right there in the bottom of my foot, you know, working on stuff like that, I was always kind of on that part. So it wasn't healing, it was kind of getting a callus around that ulcer. So we tried to do a skin graft, you know, try to heal it. That didn't really, it took the first time, but the second time when they did it, they wrapped the foot too tight and it ended up getting infected within like 2 or 3 days. And the infection went to the bone.
Yes.
So we did get that amputated.
Yes.
So there goes 2 toes. We came back and we were healing with that. And it healed, but now that I was in my shoe, my foot was, you know, kind of like pressing against the bottom of my foot.
Yes.
Kind of like, it wasn't like the foot was, the shoe was too small or too big. It was just how my foot sit now. So we needed an insert to kind of correct that.
Yeah.
But I didn't get it. And the tip of my big toe and the side of it kind of started getting, you know, like little ulcers there. And it ended up getting really infected to the bone. And I decided, hey man, like, the first time I had the toe amputated and after the second surgery, they were saying that, hey, you know, we might as well get rid of them. Nobody wants to hear that.
Yeah.
But after all of the surgeries, I said, you know what? You know, let's get rid of them because it seems that I was within a year and 6 months, I was 3 surgeries in, about to have a
Yes.
4th one. So I decided, look, you know, if I can get 80% of my foot and not be in the hospital back and forth,
Yes.
let's do that surgery. We did it. I healed up real good. So through all of those surgeries, I spent a long time in a walking boot.
Right.
So now that I'm out of the walking boot and foot's completely healed, like I said, I got 80% of it. I'm happy with it.
Do they feel like it's going to progress? Do they feel like it's going to affect more of the bones in your foot?
No. From all of the ends of the metatarsals, they did the surgery there, so it was a clean cut, and you know they did a little flap over. It healed good, so no effects here on out. I should be good.
Okay.
The only thing now is building strength back up in my legs. So that's the main reason why I decided, hey, I want to go see a chiropractor, because I know I need some kind of adjustments. Because for one, I spent a lot of time in a walking boot. Now that I'm out of a walking boot, I'm gotten a lot better with walking now, but the first couple of months out of that walking boot was a struggle, because had literally no strength in that one, and really not a lot of strength in my right leg either, because I usually sit down. I sit down for work anyway.
Right.
So I wasn't doing any walking or anything like that. So I would do things like try to go to the mall, walk around a little bit. I stay on the 2nd floor, so I do got some stairs, but my goal is to kind of get back in the gym, kind of build some strength in my legs, and work out a little bit and get back into some kind of shape. I am a different type of diabetic, I guess. They call me like a hybrid.
Okay.
So my body doesn't make any insulin, and I'm able to sustain real high blood sugar levels.
Okay.
So when I have a high blood sugar level, I'm walking around, I don't really notice it.
Correct.
But when it gets low, I notice it. I feel like I'm on like LSD or something like that. So we did a lot of the, vials and, pricking my finger stuff.
Yeah.
It wasn't until I got the Dexcom.
Yes. Mm-hmm.
I'm getting a pump.
Uh-huh.
But first they wanted to make sure that we could try to get my blood sugar levels down.
Okay.
And this Dexcom, where it checks my blood sugar level every like 5 minutes.
Yes.
That's been amazing. So since we've gotten that, it's been going down. It was a fight to get this stuff done.
I understand. Yeah, I have patients that have had trouble like that. So that's just monitoring. That's not putting anything in. You have to put it in.
I have to put it in, but it gives you a real perspective of where you're at when you eat, what affects it, and stuff like that. Because when you do it the other way,
Snapshots. Snapshots. Yeah.
It's like you take your blood sugar level or you check it probably every time you eat. So if you ate 3 times a day, you're seeing it 3 times a day, maybe
Correct.
4 if you want to check it in between, and that's not really that good. Because it could be good around that time, but then some other times it could be really high, and I don't know because I'm not even thinking about it.
It's moving all over the place. Yeah.
Exactly.
All right. So, how's your other foot feel? Do you have any neuropathies? Do you feel like there's any
I do have neuropathy, but it's not too bad.
on both feet, or do you?
Yes, on both feet.
You probably already know some of this. I'm just going to go over for people watching. The health of the tissue comes from the nerve, comes from the blood vessels and also the nerve. And the nerve controls blood vessels, the nerve controls the health of the tissue, controls your immune system to the area. So when you have an infection or a wound, the ability for an infection to grow, and then the nervous system is actually what brings the warriors in to help fight the fight. The farther you get from your heart, the more likely there's less circulation, so it typically affects extremities, or the farther you get from your heart. The neuropathy happens because there's actually the actual high levels of sugar damage the nerve endings a little bit in the foot, and so we want to, obviously having understanding with a live real-time chart, your blood sugar helps you keep that from getting too high. Obviously with diabetes, you're expecting some level of neuropathy, but you can have neuropathy from the lower back, and so the health that's one continuous nerve leaving your lower back all the way down to your foot. You can irritate the nerve here, the nerve can be irritated in your foot. Typically what I treat is everybody's got it, disc, joint, inflammation in the lower back from posture, and that probably is going on also. I mean, you're getting some level of overlap. There is the sugar levels, and then you also have pressure, inflammation, let's say, or just from sitting. You said you do a lot of sitting throughout your day. So sitting brings its own, I call it the new smoking. It brings a lot of stress on one area of your back. Typically, there's a transference of work. So the middle back becomes tight, the lower back gets sent all the work, the lower back controls your foot. So cleaning up those nerves a little bit will definitely help the nerve in your leg be as healthy as possible. And so getting as much pressure off your lower back, teaching you about the curve that's supposed to be in your back, the lordosis, we'll go over that.
Say from here to here, there's not really a lot of feel. I could feel like when I touch my foot like that, but it wouldn't be the normal, like how you can feel.
When you compare...
Yeah, I feel it, but it's like a slight.
Uh-huh.
It wouldn't be how it would anywhere else. Yeah, barely can feel that.
Barely feel L4. This is Kind of L4 is the inside of the foot, L5 is the top of the foot. How about the side here, the pinky?
Not too much.
Not too much, so S1. And then as I go up higher.
Yeah, you can feel it once it goes up higher.
So because this is 3 dermatomes, we call it, 3 levels of neurology. It's unlikely we have all 3. It could, it's more likely this is from the diabetes than it being you have 3 disc injuries in your lower back, because we call them dermatomes. So one nerve controls one section of your foot. So this is the lumbar 4, lumbar 5, and then S1, sacral 1. And so to have that level of, it'd be unlikely.
Right.
This is where it's diabetes. Away from this side, obviously, but with your foot, you're putting more, you're favoring that right side a little bit. Hips are pretty level. Gosh, I don't see much in terms of the hips. It's good, look straight forward. And so we're dealing with about, about 2 inches your head's forward. The more forward the head goes from your shoulder, the head weighs about 10 pounds. So when we're sitting for a long period of time, the ligaments on the back side of our spine get stretched out. So when you come back to upright, your body doesn't go back to neutral. Does that make sense? We stay somewhat rounded forward, and for you right now, this is where your home is become normal. Does that make sense? You're supposed to be, here, and not by muscular contraction, just by where you want to be. And so in order to do that, we need to make sure that all the joints in your spine are all freed up. Then we have to counter stretch you, meaning we have to take you farther back than where you want to be, so that the middle is where you want to be when you're upright. It's like a tree leaning over. You can't just take it and ask it to be upright. It'll just keep. So you have to overcorrect the other way, hold it there, and then the middle ground will be where you want to be.
Right.
Where you're bending too much, you'll see that on MRI as a part that's aging too quickly. So the discs represent like tread on your tires. When you age a disc, it starts to get thinner, it bulges, and so we want to. Without an MRI, I don't need one to treat you, but that's where, it wouldn't be. How old are you? What's your age?
36.
1 year, I'm 37. So I expect to see a 36-year-old MRI. What happens is many times people get to 36 and part of their back looks 50, or 60, and that accelerated aging is going to affect your feet even more so, because we want to keep your spine young, keep your nerves and discs young, so that we don't have this accelerated aging. You cross this arm under, over, bend the knees for me, feet flat on the table. Got you, there you go, good. Perfect. Take one deep breath in for me, and then let all the air out. Let all the air out. Deep breath in, it's okay. Head back. Deep breath in, it's okay. Head back. There we go, okay. So we got about 3 or 4 bones to move, it's okay. We got work to do. If this is tight, then when you're bending to get in and out of your car or life, another part of your back must be doing extra, and that's what concerns me. Because if this is so stiff, you're probably making this or your lower neck do extra, which is going to affect your legs, affect your arms, and that's what we want to stop and slow. Scoot down for me. I'm not going to fall, I promise. Nobody falls off my table. Nobody falls. All right, bring this arm back a little bit. All right, look over this shoulder. Just turn your head. There you go. Deep breath in for me. And exhale. Good. Other side for me. Other side. Okay, good. Perfect. And look over this shoulder as best you can. And then exhale. All the way out. Exhale. All right, good. Face up for me. All right. So sometimes I adjust people without massaging them first, and the idea is to kind of like one of those undercover bosses, come in unannounced and ask, right? And to ask the spine to, well, how about this? Check to see if the spine's doing what it's supposed to be doing without the employees knowing that I'm going to be watching. And so I want your upper neck to feel soft, and if this area is rigid, then we have work to do. All right, real gentle. Mm-hmm. There you go, nice. Chin up and relax. There we go, all right. A little tighter on that side. You all right? Yep. Okay, good. We'll go deeper in a second. It's not right here your body's trying to lean away from. There it is. We have injuries and, I don't know, so you have one brother, how many brothers?
Oh no, I got a lot of brothers.
A lot of brothers, okay, so and you're the
brothers and sisters.
Are you the youngest or one of the
I'm more of like a middle.
Okay. Sometimes the youngest kids get the most beat up from having their
Well, I definitely took my turn of getting beat up.
All right. Well, my point is that so usually I had I had 3 brothers one time, and the oldest brother's spine looked perfect on X-ray. The middle child's spine looked pretty beat up, and the youngest child's spine was the most beat up. And I remember my dad looking at the X-rays, and when he put them up on the board, and then looked at the oldest boy and said, you kicked him, didn't you? Because it was like, and the mother was like, oh no, he's a perfect little, I'm like, and then we had friends that knew these boys, and like, oh yeah, we see them, the oldest boy beating up the younger kids all the time, and the mother was like, oh no, he's a saint. Mm-hmm. I got you right there. So it's like a bolt on a car or a hinge. We got to get some oil, some blood into the joint to help make it softer, make it more willing to work. It shouldn't require a He-Man level of force to get the joint to move. This is supposed to be a pretty supple joint up here, and so sometimes you get some overzealous chiropractors that want to, really go crazy on it. And I go, my first contention with that is that why is that good to even put that much force in somebody's neck to begin with? The joint should never be that stiff to require that much force. So, and perhaps maybe because you don't do any soft tissue work, it needs that. So you'd have to just keep hoping that you could put enough force to get the joint to move. The problem is almost like if you're a baseball pitcher, the more velocity you try to throw a ball or football, right, the less accuracy you're going to have, right? Mm-hmm. Right. So you kind of, I'm sure some
touch.
Right. I'm sure some baseball pitchers could throw faster than 98, but their accuracy now goes to,
right.
I can throw 105, but who knows where that ball's going to go, And so when you increase the force on the adjustment, your accuracy goes down. So force goes into areas that you don't really intend the force to go to. So we're trying to adjust, meaning loosen certain areas and to leave other areas alone. Balance your neck, get your upper neck working independently. This is supposed to be your main engine, and the right side moved pretty well. The left side gave me some resistance over here, right there. I want it to feel supple. And this, like I said, might have to do with just how you're walking differently with the boot, and the word, maybe you've heard or maybe not, it's okay. The word subluxation was a word that chiropractors tried to use to deem that it was not in the right position. It was sub, meaning less than, luxated, meaning dislocated. So the bone is less than a dislocation. It's in the car's in the garage, but it's crooked, right? Okay. So the bone is not dislocated; it's subluxated. So there's very little subluxation on the right. The left has a larger misalignment, and that's where I feel like you're spending more time on the left side of my neck, and the answer is correct. I'm not going to spend as much time over here because the misalignment is a lot less. Your neck doesn't want to tilt this way that easily.
I definitely do feel it.
Yeah, your neck doesn't want to come on over here. It's like a car. I'm letting go on the steering wheel, and the car just pulls to the right. Well, my car's always pulled to the right. That's not supposed to do that. Just grew up with the father as a chiropractor, and he wouldn't have let this slide. We just don't have we have very little spinal examination in our life. It's like, okay, touch your toes. All right, you're good. As long as you can touch your toes, spine's healthy. Okay. There we go. So they came up with a way to basically help speed up blood flow. So even with your foot, gua sha is a great tool, cupping, to help get the dead blood out of there, where the foot is an easy area for stagnation. Mm-hmm. And that stagnation, especially if it's high sugar content stagnation in blood, that affects the nerves. So keeping the circulation flowing in your foot is vital, even with monitoring your blood sugar levels. This is that knot that I was speaking of. There's a mark right here on your neck, and when you get home and family members see your neck, oh yeah, Ed got you.
It's gonna be the bruising. I've seen it on the videos.
Yeah, right there. There's this is what I can feel is that knot right there. Is this?
If those necklaces are in your way.
You're fine. No, I think you're good. You're good. I'd almost argue that where your necklaces are is where you should never be worked on. So it's like almost like a little shield, Leave the necklaces on. That's the lower neck where everybody ends up getting worn out. And so I'd say that you don't really have any benefit by going in there and further loosening what's already loose and worn out. Leave it alone.
Okay.
spend time up here, so a little bit there too. So this is your neck belongs way back here. This is when I was looking at you from the side with the head being forward. We have to counter stretch, so loosening up the neck and then getting your head to arch back and then holding it here is what it takes to change your posture. So it's time in the opposite extreme. How does that feel right there?
It feels pretty
Okay.
tight.
Yeah, tight, but we just want to, we gotta get used to being here. And there you go, a little piece more. I'm a greedy chiropractor. I want those Best Buy commercials. I want it all. I want it all. I want it now. It feels here. Yeah, it's here. That's left.
Yeah, I always try to I have like the gun,
Mm-hmm.
and I always try to go under my arms, the lat muscles and stuff like that.
Is it one side hurts you more? Do you feel like there's one more?
I'd say the left definitely hurts more than the right.
Yeah, left's a little higher here. That's what I'm trying to say. This is, when I look at your back, it's not too asymmetrical. Both sides are symmetrically out of alignment. How about that? But there's not, sometimes you'll have, the worst case is asymmetrically out of alignment. And that makes sense. Both are out of alignment and then one's worse. The head's forward. This is more posterior than it should be, but we want to loosen it up and then start showing you how to counter stretch. And everybody wants to teach you about nutrition or diet, but where's the spinal advice? There's hardly anybody. Well, just wait till it hurts. Wait till you have symptoms, or how do you feel? It's not how you treat your teeth. You're given guidance with your teeth to treat your teeth, brushing and flossing and going to dental hygienists even before there's symptoms, checking out your alignment with orthodontistry. Yet we have zero spinal education on how to keep it clean or how to check its alignment.
Yeah.
And that's my niche. That's where we are. Sometimes you actually feel it in your hip or down the leg when you work here. Sometimes this is what I use as almost like the proof of what I'm trying to say to you. Right there.
Mm-hmm.
You might feel that, and that's the first place. And right next to his jaw, right on his bottom lip. I'm teasing. I think I'm putting my elbow right into his mouth. All right, that's where the junction is. I gotta close my eyes. I can't look at him. He's scaring me. Why'd you keep your eyes closed while you're working on his back? I'm just getting scared.
Well, somebody's got to watch my back.
That's right. He's watching it, man. He's.
It's gonna look like it's gonna have blood coming out of its mouth when you brush off.
I think I made him angry. That's the beginning of the nerves that go to your foot. So keeping this area as tenderness free as possible. It's one essentially, continuous wire from really here out the exit down to your foot. And so It's for the parts for the people that always comment. Could you do a little less talking? This is for you. You know, it'd be a better video if you just didn't talk so much.
I think those people just enjoy the people's elbow.
People's elbow, that's right.
Yeah.
Yeah, I definitely want to work on his legs a little bit. We want to some degree, we should have, I don't know, some level of routine work on your legs to make sure the circulation is what it should be. You know, especially when we sit, the iliac and femoral arteries that go into your legs they make a 90-degree bend when we sit. So it makes it easier for blood to get congested in your legs when we sit. So this is something we have to contend with. All right. Right there.
So I should be getting up, moving around a little bit more.
Yeah, oh yeah. Well, it's just tough. It's when we don't move, the sensors are all based on motion, so sometimes we feel better when we don't move, and then something happens and we don't connect the dots between it was the not moving that caused it.
All right.
And that's tough. And yeah, he's got some blood dripping out. Yeah. It's not blood, people. It's just some wash off. So these are the roots of your neck right here. This is the other end of that is down here on the side shoulder. Same muscle, other end.
So is it bruising up pretty good?
Right up here. Yeah, this is from the head being forward, right? So the alignment of your head to shoulders. These muscles are working harder than they're supposed to be. So this is a postural stress. You know, unless you work like Tom Cruise in Mission Impossible, hanging from the ceiling with that harness. You know what I'm talking about?
Yeah.
No, Ed, that's not how I do paperwork. Floating from the ceiling, right? I'm making a pretty large assumption here, right? That you're just sitting in a chair, right? That's what causes it. It's if you had the ceiling harness thing, you know. Was it Jean Renault's holding the? Then there's a rat up there, and
It looks pretty cool because you're bruising up pretty good, and with the tattoo.
Where's the eyeball? Nice turn. His eyes are turned red. He's bloodshot now.
Hard day at work.
Hard day at work.
Yeah, I'd say about maybe 5 years ago, I was working at a job and I realized my back was just really starting to tense up a little bit. So I tried to look up a couple of stretches to do, but it's hard because I'm always in that position.
Yeah, right. So it's two reasons why muscles will get tight. You either have muscle guarding, you know, an injury, fall, car accident, muscles get tight to protect. But more long-standing will be postural contractions. So you have muscles that are contracted because the alignment. It's like if you hold a bowling ball out in front of you, your muscles are going to work harder than if it's closer to your body.
Right.
So the alignment, the position your body's in, determines some level of muscular stress. And, you know.
Yeah, those calves are really tight.
Yeah, you should have some level of having these checked out every once in a while. You know, obviously controlling the sugar levels first, you know, getting that real-time monitor, and then you controlling that. But you know, I've had people like, you know, similar symptoms that they get a lot of benefit by getting their back cleaned, getting their legs, you know, the blood flowing in and out faster, not letting anything stay congested. Obviously, you've probably seen those things that squeeze. You know, you can put something on your leg if you're going to be stuck sitting for a while, right? So there are compression things that, you know, keep trying to help excavate blood flow, doing circles with your ankles, you know, moving your leg around.
I got one of those foot pedalers for our desk.
Yeah, well, I'll take anything. Except motion is how things are pumped in your body, or at least assisted in pumping. And most of the blood likes to make a U-turn right above or around your knee. And so below your knee especially is where it's like your body quickly diverts circulation to it. So whatever blood's in the area is more likely to just hang around. Yeah, my dad's had numbness from his lower back, not from sugar, but since I was a kid. It happened since in his 20s. And remember, my dad, similar to your foot, was numb on the side of the foot, and we went for a run one time as a kid, and I think his sock had bundled up or wasn't, it was causing a friction, so he had a giant ulcer wound on the side of his foot, and he was bleeding when he took his shoe off, and I remember thinking, like, Dad, that's got to be killing you. And he's like, I can't feel it.
Yeah.
You get this big wound and ulcer, and and everything in one of my dad's feet, it just heals slower. When you can't feel yourself, when you're disconnected from your body, it's easy to damage yourself. We demonize pain in America, but if my dad knew his sock was all bundled up, he would have, maybe stopped running and adjusted his sock.
Yeah.
And it wouldn't have caused the friction that wounded him. But he couldn't feel it, and so he just kept going. And
it's like your body's alarm clock, like, hey.
right,
Good,
just
yeah.
try to, hey, look out. I mean, there are people with spinal cord injuries so when we have a spinal cord or brain injury, sometimes the pain comes from the lack of a no pain signal. So when things are hooked up properly, you get a no pain signal from an area, like almost like an all clear signal comes from the nerve. And so when you have spinal cord injury, you lose that no pain signal, which then is interpreted as pain. This is what phantom limb pain is. So when a person loses an arm, let's say in war, does that make sense? They have pain in an arm that doesn't exist, right? Because the brain still perceives it to exist. And then the lack of the no pain signal is interpreted as pain.
Yeah, it definitely feels tight.
In and out, baby, in and out.
Nice. Nice extra. Good exhale. Okay, good. When you have any wound to your leg ever in the future, a good idea would obviously get ice on the area of the wound. That helps to constrict the blood flow in the area where there's damage. That creates a pumping action. So when you let go of the ice, then it dilates, and that creates a pumping event. So you think, well, ice is cutting off the circulation. I thought that's bad. Well, the pumping action is what benefits the tissue. You understand? So, and then don't feel like you have to rub. Obviously, you don't want to rub the wound. Even rubbing around any wound is beneficial. So when you have a wound like this, above, below, you put heat around it, kind of idea to help speed up circulation. Obviously, if you see signs of infection, it's not good, but my point is that you can, once the wound calms down a little bit, even working around it is beneficial.
How does that feel on your leg?
Feels good.
Does it?
Just
Yeah.
trying to get it warm and toasty, help bring the blood through it. Your calf muscle's not as large on your left and your right. Both of them are a little diminished, but this is definitely has to do with the same nerve that goes to your foot. And you're saying numbness to your foot is also numbness to your calf. So the strength, and it's not from a lack of you working out or walking. You understand, this is not a disuse atrophy. This is a neurological atrophy. Checking for any pitting edema, if anything. A little bit here. So when I press in, it stays pressed in. So I just press that in and it's staying kind of sunken in its appearance, and how long it takes to kind of rebound out. Even on the amputated foot, there's actually very little. Does that make sense?
Mm-hmm.
This side, there's no pitting edema on this side, but I would definitely, to save your right foot, I don't want anything happening to this foot. We want to just work on circulation as best we can, not letting blood become stagnant in here.
Well, I have a wireless headset.
Yeah,
So-
yeah. Well, I don't take a shoe off. Like I said, like it's all swelling's gone down just from what, a minute there, 30 seconds. Just all that pitting is gone. Part of your budget. I don't know. Part of your health budget. I don't tell you. You gotta. Yeah, you should have. I don't know if it's just having your feet massaged, helping make sure that circulation is flowing in and out of here.
I got a couple of gadgets too.
Okay, good.
For Christmas, I got one of those things that you can stick your foot in.
Yeah,
So I stick my foot and my calf muscles in it.
good. Yeah, just every rest of your life, just along with controlling the levels, just being aware of that. It goes away real quick. Like there's no more pitting anymore. It's all that we flushed it all out. It's just
Just needs to be done, huh?
yeah, you don't want that stagnation. It's like leaving love bugs on your paint of your car.
Yeah.
It's just gonna, if you leave that there for a long period of time, it's gonna affect the internal health of the tissue. And there's not a lot of people like me that go in here and try to flush tissue. So I was like, well, the health. There's a muscle in the blood vessel. So arteries have muscles in their walls. So in the same way that your skeletal muscle's weakened, you understand, the muscle in the artery is weakened. So your ability to push blood to areas far away from your heart is harder. So that's why you need assistance. And that's, you don't just have atrophy to your skeletal muscles, there's atrophy to the muscle in the blood vessels. And it's tough. I wish this actually feels really good over here. There's no.
So you're saying that's my good foot?
Well, I'm just saying, it feels much better. This side, actually, I got much more circulation issue on that right.
And it's the most action my legs ever seen.
Other than the tattoos, right? Exactly. Other than
Yeah,
the poor tattoo.
Yeah. People always ask if those tattoos hurt. I was like, well, I was watching Black Panther while I was doing it.
That's awesome. That's awesome. I had to work on my dad's feet just like this, just helping him with his, feet also. Just it's tough. I've watched my dad work on his own feet like this, just trying to help flush it. Yep, keep blood flow in and out. Yep. Love you.
Yeah, I got some gadgets. I have the roll recovery.
Mm-hmm.
I have, like I said, the one where you can put your feet in. I think it's like a swash, some kind of word. Don't make me laugh.
Yeah.
It's,
Okay.
like a Japanese massage type
Okay,
of thing.
cool. Good.
And then I have the massage gun.
Nice.
Let's see how the ankles feel here. Here we go. I got you. There we go. Good. Okay. Good. Go ahead and tilt your head to the right for me. It's her favorite. All right, tilt your head to the right.
Oh, that was a big one.
Don't take the area. All right, go ahead, tilt your head to the left. There we go, a little bit, yeah. Tilt your head to the left. Sure, Ed. So I like the elliptical. I like things where you're not flexed at the waist. Bicycling, rowing, you're bent at the waist, which you're already doing a lot of that throughout your day. So let's not do more of that at the gym. Being upright, walking briskly, or the elliptical I think is the best, where you just have that swivel motion up the resistance. If your spine's healthy through my office, to me, I want you to be able to do whatever you want to do. Would be my ultimate goal. If you want to play golf, that's fine. Go play golf. But my point is that you want to have your whole spine working when you're doing those activities,
Right.
and you're not doing it with a small percentage of your back operating. So, doing great.
What about like strengthening the calf muscles?
Yeah, I mean, you want to stimulate. So part of it isn't just a foregone conclusion. The more you stimulate it, the more likely it is to redevelop. So exercises where you're, like my dad is unable to stand on, I believe it's his left foot and come up on his toes, right? There's not enough power going to that calf muscle. The worst thing that would be sedentarism for you. It's going to just quickly take you down in terms of health. You want to keep mobility. When I pressed in, it stayed sunken in. If you see that happening, you really should, that means there's a lot of stagnation any wound that you have in an area that's pitting edema is going to get a high chance of infection. So that would be the healthcare on that. All right, friend.
All right.
I'll talk to you soon. We'll hang out. All right, very good.